Did you know that a single drop of infected blood from an Ebola patient can contain over 100 billion viral particles, enough to end a life in days? When the first cases appeared in a small village in Zaire, 1976, doctors didn't know what they were facing. People bled from their eyes. Families vanished overnight. Nurses collapsed beside their patients. Within weeks, entire villages were gone. The virus had no name, only fear. Hello and welcome. Today, we're diving into one of the most feared diseases in human history, the Ebola virus. In this video, we'll uncover what this virus really is, how it spreads, why it's so deadly, and what humanity has learned from decades of outbreaks that tested the limits of science and courage. Because Ebola isn't just a story about a virus, it asks a story about how fragile our systems are, and how close the world once came to a collapse far greater than we imagine. To understand Ebola, we must strip it of the myths that surround it. According to the World Health Organization, WHO, Ebola virus disease, EVD, is a severe, often fatal illness in humans caused by infection with a virus from the Filoviridae family. The name comes from the Ebola River, near where the first known outbreak occurred. But what does that actually mean? In simpler terms, Ebola is a microscopic assassin. Once inside the body, it invades cells that line blood vessels, the walls that keep your blood where it's supposed to be. It destroys them. Then it hijacks your immune system, turning it against itself. Instead of fighting the virus, your body begins to destroy its own tissues. That's why victims bleed, not just outside, but inside. Their organs fail. Their body becomes a battlefield. There are 6 known species of the Ebola virus: Zaire, Sudan, Bundibugyo, Thai Forest, Reston, and Bombali. Among them, the Zaire strain, the one that caused the massive outbreak in West Africa, 2014-2016, is the deadliest, with case fatality rates reaching up to 90% in early epidemics. Unlike airborne viruses like the flu or COVID-19, Ebola doesn't spread through the air. It needs direct contact with blood, vomit, sweat, or contaminated objects. But in communities where protective equipment is scarce, even that is enough to ignite an inferno. The virus starts small: a fever, muscle pain, sore throat. Then comes vomiting, diarrhea, internal bleeding. Within days, the body shuts down. Without treatment, death often follows within a week. But here's the most chilling part. Ebola doesn't kill fast because it wants to survive. It kills fast because it doesn't need you. It doesn't care about spreading quietly like the flu. Its existence is built on chaos. And when chaos ends, it moves on. Ebola sits at the intersection of biology and tragedy. It's not just a virus. It's a mirror reflecting how human behavior, funeral traditions, poverty, weak health systems, becomes the perfect accomplice for its spread. That's why understanding Ebola isn't just about virology, it's about humanity. When Ebola resurfaced in West Africa in 2014, the world wasn't ready. The virus had appeared before, in small, remote outbreaks, but this time it reached the cities. It leapt from forest villages into crowded markets, hospitals, and capital airports. It wasn't just a health crisis anymore. It became a test of global solidarity. The first spark ignited in a small Guinean village called Meliando. A 2-year-old boy fell ill after playing near a hollow tree filled with bats, the suspected reservoir of the virus. Within weeks, his family, his neighbors, and the local midwife were dead. What began as a local tragedy soon crossed borders into Liberia and Sierra Leone, spreading faster than any Ebola outbreak in history. Hospitals turned into danger zones. Doctors and nurses worked without enough gloves or gowns. When they touched their patients, they risked their own lives. In many villages, people began to fear hospitals more than the disease itself. Some hid their sick relatives, others ran from quarantine. And the virus kept moving. By the time the World Health Organization declared a public health emergency of international concern in August 2014, the numbers were staggering. Over 28,000 cases, more than 11,000 deaths, entire communities erased from the map. But behind those numbers were human faces. Children left without parents, streets lined with empty homes. Burial teams dressed in full protective suits, moving silently through neighborhoods to collect bodies no one dared to touch. One Liberian nurse, Salome Karwa, survived Ebola and returned to the same clinic that had nearly killed her. She became a symbol of courage, the face of a world learning to fight fear with knowledge. Still, fear was a virus of its own. Airlines stopped flying. Borders closed. Misinformation spread faster than the disease. Some claimed Ebola was a government conspiracy. Others believed it was witchcraft. In the chaos, trust, the most critical tool in public health, began to collapse. Every great epidemic reveals two sides of humanity: panic and resilience. While fear paralyzed cities, an invisible army of scientists, doctors, and community workers rose to fight back. In the labs of Geneva, Atlanta, and Kinshasa, virologists raced against time to decode the Ebola genome. Their goal: understand how this strand of RNA could turn a healthy human into a shell within days. Meanwhile, Médecins Sans Frontières, MSF, and local health workers built makeshift treatment centers in the heart of the outbreak. They faced unbearable choices: which patients to isolate, which to comfort, and how to explain to families why they couldn't say goodbye. Their courage came at a terrible price. More than 800 healthcare workers were infected. Over half died. But from that sacrifice came knowledge. Scientists learned that early detection and supportive care, fluids, electrolytes, oxygen, could double survival chances. For the first time, there was hope. In 2015, a vaccine candidate named RVSV-Zebov showed near 100% effectiveness in field trials in Guinea. Years later, it would become the first approved Ebola vaccine, transforming fear into preparedness. The Ebola crisis reshaped global health forever. It exposed how slow bureaucratic systems fail during emergencies and how community trust matters more than international funding. The WHO faced harsh criticism for declaring the emergency too late. In response, new systems were built. The Global Health Emergency Workforce, CEPI, and improved surveillance networks designed to detect outbreaks before they spiral. Ebola forced the world to admit an uncomfortable truth: that in a globalized age, no epidemic is ever local. Ebola's story didn't end with the vaccine. Its echoes shaped how the world would later face COVID-19, Marburg, and other zoonotic threats. In many ways, the West Africa outbreak became a rehearsal for the future. It taught that fear spreads faster than infection, that community education is stronger than quarantine, that heroes don't only wear lab coats, sometimes they carry shovels to bury the dead with dignity. It reminded us that viruses are not the enemy alone. Complacency is. In 2018, another outbreak struck the Democratic Republic of Congo. But this time, the response was different. Health workers had experience. Vaccines were ready. Data was shared globally. The outbreak was contained, proof that humanity can learn. Ebola, in the end, is not just about death. It's about awakening, a brutal reminder that nature does not negotiate, and that our survival depends not on fear, but on understanding. Ebola may seem distant to most of us, a nightmare confined to the rainforests of Africa. But its lessons reach far beyond borders. Every outbreak reveals how connected the human world truly is, and how small actions, multiplied across millions, can change the course of an epidemic. At the individual level, awareness is the first shield. Ebola spreads through contact with body fluids, so prevention begins with simple habits. Avoid direct contact with the sick. Wash hands frequently. Use gloves and masks when caring for patients. But beyond hygiene, the deeper message is vigilance. To recognize symptoms early, report them fast, and never let fear silence truth. Because silence, in an epidemic, is lethal. At the community level, trust is the medicine science alone cannot create. Villages that worked with health workers, not against them, were the first to recover. Local leaders, pastors, and teachers who joined response teams became bridges between fear and understanding. In places where misinformation once killed, education began to heal. This is the heart of public health. Not just vaccines and laboratories, but the human bond that carries truth faster than rumors. At the national and global level, the fight demands infrastructure. Hospitals need protective gear and trained personnel. Governments must invest in surveillance systems that detect outbreaks in days, not months. Borders and politics cannot be allowed to slow down data or supplies. The Ebola crisis pushed nations to create networks like the Africa CDC, and programs such as COVAX, later used in COVID-19 response, proof that preparedness isn't a luxury, it's survival. Science, too, carries hope forward. The Ebola vaccine now protects frontline workers and at-risk populations. Rapid diagnostic kits can detect infection in minutes. Researchers continue studying how bats harbor the virus without dying, a mystery that might one day unlock new defenses against zoonotic diseases. Each discovery is a small victory in humanity's larger war against invisible enemies. Yet, none of these advances matter if the world forgets. When fear fades, funding fades. When headlines move on, laboratories go quiet. And that's when the next outbreak finds its chance. So, what have we learned from Ebola? That a virus smaller than a grain of dust can humble entire nations. That the first line of defense is not medicine but trust. That courage can spread as fast as fear, if we let it. And that the fight against one virus is the fight for all humankind. From the jungles of Zaire to the hospitals of Monrovia, from the labs of Geneva to the hearts of survivors who returned to save others, the story of Ebola is a story of resilience. It shows us that even in the darkest outbreaks, humanity's light still burns. Remember the question we began with? How can a single drop of blood hold 100 billion killers? Now we know. It's not just about the blood, it's about the world it enters. If this story moved you, share it. Because knowledge is the vaccine we can all give. Subscribe for more explorations into the unseen battles shaping global health, and join us next time as we uncover how new viruses emerge and how we can stop the next outbreak before it begins. Together, awareness saves lives.